In this chapter, we will be talking about drug therapy for insomnia. So, sleep is a natural and necessary periodic state of rest for the mind and the body. So, we know that when we sleep, our bodies that technically rest and restore its energy levels that were used up for the day. This chapter will be talking about drugs that used for sleeping, possible effects and side effects, adverse effects of these drugs, what to do before and after giving these medications, teaching of your patient what to do, what not to do, and when to call the doctor, and describe lifespan considerations. So, as we mentioned, when we sleep, our bodies rest and restore the energy levels. During the sleep, your consciousness is partially or completely lost. Your eyes are closed. Body movements are decreased, metabolism is slower, and responsiveness to external stimuli are also decreased. Insomnia is an inability to go to sleep or remain asleep throughout the night. It's the most common type of sleep problem. Most people experience acute or short-term insomnia at some time during their lives. So symptoms includes difficulty sleeping or difficulty falling asleep or waking up often during the night or early morning and feeling of not rested after sleeping. Insomnia can lead to sleep deprivation. Um, Sleep deprivation is a shortage of quality uninterrupted sleep, which reduces physical mental well-being. Symptoms of sleep deprivation includes impaired coordination, judgment, impaired reaction time, and impaired social function. This can also lead to drowsiness, anxiety, irritability, and impatience. So when we talk about drugs for insomnia, mostly we are using sedatives. Um, Sedatives is a broad group of drugs that promote sleep by acting on signals in the central nervous system to produce calm and ease of agitation. This includes benzodiazepine receptor agonists, which are not technically benzos, but they act like ones, which turn on the receptors in your CNS to induce sleep. This includes your Lunesta and your Ambien, if you have ever heard of those. Benzodiazepine, of course, these are your benzos, your lorazepam, your Ativan, your Xanax, your Klonopin. They depress your central nervous system by binding into the GABA receptor. You have your barbiturates, which depresses your CNS function. This includes your pentobarbital or psychobarbital, which forms a barbituric acid in the brain that induce general depression of your CNS function. You can also use antihistamines such as your Benadryl, um, which have some sedating effects. You can also use sedating antidepressants such as Remeron and Trazodone, and skeletal muscle relaxants, which includes your Xanaflex, cyclobenzaprine, or your Flexeril. So the intention of these medications is to relieve insomnia by either stimulating an increase in inhibitory neurotransmitter GABA or acting as an agonist of GABA receptor. So the intention of the medication is to relieve the insomnia and the sleep is improved. There will be sedation, so sleep is induced. There will be decreased length of time to falling asleep and increased sleep duration. Side effects of these drugs includes amnesia, drowsiness, dizziness, hallucinations can occur, headache, lethargy, diarrhea, nausea, and vomiting. Adverse effects include liver or kidney problems, which can cause side effects. Sleepwalking has been reported. This can be potentially addictive, and this lowers your patient's seizure threshold. Before giving this drug, you have to know their usual sleeping patterns. Any specific difficulty, is it difficulty falling asleep or difficulty staying asleep? You have to ask about history of depression or any history of falls, and assess their mental status. Um, you also need to check their vital signs after this medication and during the course of the medication. Check the level of consciousness and watch for changes in the mood, blood pressure, heart rate, as well as their consciousness. You have to teach your patient to take these medications exactly as prescribed. And keep their follow-up appointments. Never take a double dose of this medication because it's increase the accumulation of the drug. Take only for a short period of time unless otherwise specifically said by your doctor. Go to bed immediately after taking these drugs. Do not take on overnight trips because you can develop a traveler's amnesia. And avoid activities that require alertness, such as driving or operating any machineries. Considerations for this medication. For pediatric patients, you have to watch for unusual or paradoxical responses, which is the opposite of what you're trying to do. Pregnancy and lactation, benzos do not take this during pregnancies, and benzodiazepine receptor agonists. This is safe in pregnancy if the benefits outweighs the risks. And older adults might require lower doses because they can increase the risk for falling.